Why isn't Singapore paying for the healthcare for its citizens?
There's really no such thing as a free healthcare. So the question really is, who pays for it?
There's a Chinese saying, 羊毛出在羊身上. The goat's hair always grow on the goat.
In many advanced countries, the government pays for healthcare. In fact, in Canada, there's no such thing as private healthcare. Now, Singapore is a very rich country. So why isn't Singapore paying for the healthcare for its citizens? Mr. Khan?
Well, first, I must say that there's really no such thing as a free healthcare because someone has to pay for the cost of the drugs, of the pharmaceuticals, pay for the facilities, and someone has to pay for the doctors and the nurses, all the healthcare workers. So the question really is, who pays for it? So in other countries, the government will be paying for it, but ultimately, it's the taxpayer who will have to pay for it. So in Singapore's case, we have actually a very comprehensive healthcare payment system, healthcare finance system, what we call S plus 3M, and MediSave, MediFund, MediShield, plus government subsidies. So together with this 3M plus S, we ensure that healthcare will always be affordable.
Ultimately, the people always pay for it. That is the first fundamental tenet of healthcare. The people always end up paying for all of healthcare. Who else pay for it, right? There's a Chinese saying, 羊毛出在羊身上. It means it's a bit difficult to intuitively understand. The goat's hair always grow on the goat. It doesn't grow anywhere else. So the people always ultimately pay for healthcare. The UK started very affordable because it's free, but not very accessible because waiting time is long. In the US, you have the opposite. Very accessible because once you have insurance, you can access private healthcare, but not very affordable. Not everyone can afford insurance. Which leads me to the second fundamental tenet of healthcare. How you pay determines how much you pay, right? If you go any extreme, you end up paying much more than necessary. But you have a judicious mix of S plus 3M, I think we make the system as lean and as efficient as possible.
How important is the reward system in keeping people healthy? Do you think it will really work?
No, I think it's important because human beings are like that. We change our behavior based on signals that we get. Being healthy and avoiding hospitalization and chronic illnesses in your old age is a very good signal, but it's too far. And as human beings, we don't see so far. No? We are creatures that like instantaneous reward. Yeah, immediate gratification. So we do need to internalize some of these signals so that people behave and in a certain way that is actually beneficial for them in the long term. It can come in the form of rewards, vouchers, but it can also come in the form of just education. Like the labeling, Nutri-Grade labeling, that was part and parcel. That was part of the war against diabetes measures, and that has been very effective. I see young people now buying bubble tea and say, I avoid D. D is bad now. So there's one thing good about our great consciousness amongst our population is that
I thought D stands for delicious.
Yeah, no. Which is bad for health, right? Detriment to health, though delicious. So they avoid the C's and D's, they go for A and B's, and it has, I think, changed the palate of a nation.
Ministers, can I ask, why is healthcare so expensive? Cost goes up every year faster than inflation. Can the government do more to control the spiraling healthcare costs?
As you know, all of us are growing older. And as we grow older, we consume a lot more healthcare. So individually, our healthcare costs also goes up by the year. And collectively, Singapore as a whole, we are an aging country. And as Mr. Ong put it, we are going into a super aged society. And as we age as a country, there will be more older people consuming more healthcare. The healthcare costs, expenditure will go up over time. There's also investments in new capability, new technology, new treatment, which is very effective. But at the same time, cost of this new treatment is also higher.
I just want to touch on one more reason that DPM Gan may not have mentioned. It's actually insurance has an impact. I mentioned earlier how you pay also determines how much you pay. And insurance is one such factor. Because if we are over-insured down to the last dollar as charged, no constraint, then someone else is paying for the bill. A dynamic will happen. Human nature is human, nobody's fault. It's just human nature between the doctor and the patient. Third party is paying for the bill, which is the insurer, or the government. Yeah, and therefore between us, the new dynamic arise, and there is always a tendency for over-servicing and unnecessary treatment. That pushes up costs. So that, I think, is the factor that's very hard to tackle and which worries us a lot.
The public sector actually accounts for more than 80% of hospitalized cases.
About that.
Given that, can't they stop the buffet syndrome? Because they're the public sector, they only give the care that is necessary. And if the bulk of the care comes from the public sector, why is the buffet syndrome such a major factor in our healthcare costs?
It's not a huge factor in the public sector, I would say. But I think the buffet syndrome do happen a lot more in the private sector. In particular, if you have a rider, the IP rider, I'm particularly concerned because when you have a rider and you have many layers from subsidy to IP rider, you practically pay nothing, very little. And that's when the buffet syndrome starts. And that only happens in the private sector where IP rider kicks in. So when we look at our data, someone with an IP rider versus someone who is not is 40% more likely to claim.
I think there's also need to have some guidelines on how riders can operate. There will be still some need to cover beyond just IP, but then the key question is how can that rider concept, additional concept, be sustainable in the long term and continue to be affordable and do not end up with a buffet syndrome at the end of the day.
Healthier SG, I think, is this preventive care. How big an impact do you think it'll have, and how long before we actually feel that impact?
So Healthier SG basically is to raise the awareness that we can take care of our health when we still can. Right? And it comes with a few key components. One is we mobilize almost the entire GP network. Plus polyclinics to encourage people register with a family doctor. Make him or her one of your best friends. So in future, any questions, any worry about your health, this is a person to go to. Keep going back to the same person because they know your health best. And they are in a position to advise you what to do in terms of changing your lifestyle, changing your eating habits, what vaccinations to take, what exercise to do, where to seek those resources. I hope there's one day it becomes very common. I go to a GP and say, I think you need to do a bit more exercise twice a week, 3 times a week. These are the exercise groups around your home. Go there, register for Healthy 365 and you get vouchers and get discounts on your premium in future. I think these are things that we are still evolving and it can happen. And for many seniors, the best support has to come from a center that is near their home. And that's where the AACs, the Active Aging Centers, come in. And that's part of another supplementary program called Age Well SG. So today we have 200 plus active aging centers. We're going to increase it even more. And more importantly, in every center, they have more and more programs.